Hey, everybody, welcome back to Dental Unfiltered. I'm Matt Brown. I'm here with my normal co host, Dr. Andrew Vallo, and we're here with an awesome guest, Anthony Rabatin. And Anthony is he's a unique office manager. He's not your stereotypical office manager. When I think dental office manager, I think woman who's been in dental 20 years. She's in her 40s to 50s, very polished, really strong knowledge base, has 30 years of great experience ingrained in them. And that's when you think office manager, what you think. And I met Anthony a couple months ago, and his approach to dentistry was different. And his approach to being a manager was very refreshing for me. And he came at it from a different point of view. And his path to dentistry was totally different because normally an office manager like starts in the front or starts in the back and hits a few positions and becomes an office manager. Anthony was very, very different, and the energy which he brought to managing the practice and his relationship with his owner doc was really eye opening for me. So we really want to talk today about Anthony. But first, Anthony, why don't you tell us a little bit about like kind of how you ended up as an office manager? Because you did it in a pretty short period of time, and it wasn't the normal path everyone goes down.
Yeah, no. Well, thanks for having me on. Very excited and nervous, but um, to just kind of start it off, I started out in New Jersey. Um, I didn't think that dental was going to be where I was going to end up. Um, my wife at the time, my now wife, she kind of was like, "Why don't you try to do something in the medical field?" This is going back about 9 years ago, um, and right across the street from my house was a dental office, and I applied with no experience, and they kind of hired me to do the front desk there. And they were looking to kind of expand their practice. I think that they had like six offices, and then within like the 2 weeks that I had first started there, they got a call center together because they were acquiring like five more offices. Um, and so I'm known in amongst my coworkers and peers to be the sponge. I just kind of pick up on information and retain and hold it. It's probably the ADHD. I'm just very like interested, and so I had picked up on the clinical side of it pretty well. So they paired me with a customer service manager. We kind of built the call center. So that was like the 2.5 years kind of like leading up towards COVID, and COVID happened and I got laid off. And during COVID, I just kind of temped for people that were sick with COVID or were on maternity leave, and I just kind of temped in offices while while we tried to get our footing, and um, took a vacation out to Florida and went on Indeed and was like, let me see what the market is down there, and like very hypothetical, very like not planning on doing anything, just kind of was like, I wonder
Just
what
look
they,
for a job,
yeah, like I
vacation.
wonder what they pay, like what's going on. It's so beautiful here. Like I'd love to wake up in the sun every day. Jersey's so gray, and so I just applied to a couple places, and I came to find out that Florida was paying like $10 more an hour for the same positions. Just kind of like in Jersey, I wasn't a treatment coordinator. I was just kind of like I was kind of the guy helping people understand, the platform that they were using, the EOM that they were using, and answering clinical questions, and like I would go home and like read clinical journals of things, and like I don't know, very nerdy, but like I was like, oh, treatment coordinator sounds like something I could do. So I applied. Uh, get all the way home to Jersey, find out that they wanted me for an interview. This was like a Thursday. My wife goes, well, do you want to go? And I literally looked at her and was like, don't joke, like don't play around. We made the decision to go that night. We left on a Friday. We got to Florida on a Monday morning. My interview was like 10:30. I think I got in at like 9 a.m. Quickly showered. My wife's grandmother had a condo here, so like it kind of made it possible for us to just kind of pack it up. And I haven't gone home to Jersey since.
Oh
Now
my God.
Florida's my home. I didn't get that first position. Didn't beat myself up about it, but now I know that that's their loss, not mine. And you know ended up with a great practice before the one that I'm at now. And I was a treatment coordinator for since then. Um, the ambition and the goal is always to kind of be an office manager, and maybe even more than that. Like I kind of knew, I kind of saw the position, I kind of saw what I wanted, and that's where I wanted to go. And to go to Matt's point of like why the relationship with my doctor is so good, and my age, I'm 28, and my age has played a factor in the dental field. I mean, more than I think I ever would have thought it would have. Um, just because I'm not 30 years dental assistant turned treatment coordinator. And like that happens so often. I kind of almost feel like that's a backwards way for me because I feel like everybody's trying to become clinical. But my passion has always been like kind of selling treatment. That's my niche. My, that's my sweet spot. And so for me, it was always like I wanted to do something, front office wise, because I knew numbers better. I knew selling treatment better. I know the clinical work and I love it like as a hobby, but you definitely don't want me in your mouth. And so I think I will always stay out of it. But that kind of brought me to where I am now. The last office I was at, um, there wasn't room to grow where I was liking, and so it was a mutual decision to kind of leave. And now I'm at Coastline, and you know, the practice I was at now has two locations. Um, I mean, the patient base is fairly similar, but I mean, the volume a lot different than when I started in this office in January. Like that brings us all the way to this past January. So like we've grown though in the last 10 months, I think more than I gave myself credit as being able to help with. And I definitely don't take it all on because it's not just me. There's little things that we've all kind of done in the office. Um, and you really have to have a doctor who's willing to like listen to their employees. That's a big deal. Like if there's something I can say to doctors who listen is like I'm trying to say this without sounding not nice, but like you guys went to
We listen.
school,
It's dental unfiltered. We do not
yeah,
nice all the time.
you went to
Just so you
school,
know.
you learned the clinical side, you learned how to be a doctor. 9 times out of 10, you didn't learn how to be a person, and so that happens a lot, where you get a lot of doctors who are just very much so like not that they treat their office staff any kind of way, but the opinions of their office staff don't matter to them as heavy
Yeah.
as maybe their
Yeah.
outside mentors or people that they listen to, and if there's anything I've learned being in a practice where it was we had 12 treatment coordinators at any given time. I mean, there was like 20 on staff, but there was always like a filtering of
Wow.
12 of us. And so, like, when you have an office that's doing that kind of volume, six doctors, two specialists, you know, eight hygienists, I mean, you kind of you learn that your staff and what we see every day is so much different. And, you know, we're seeing your day to day operations as a doctor from the perspective of your operation as a whole and not from just the operatory. Like it happens with the assistants too. Like they see everything, they get to know the patients and it's such a different relationship than what we have at the front because, they're with you in that room, just you and them for so long. Whereas, we're the ones dealing with their insurance and their money and, we're the people they don't like because we have to tell them they have to pay.
You're
And
the
y-
scapegoat for sure.
we are,
Absolutely.
we
Yeah.
are.
Yeah.
But I love that role. I will take that role for my doc any day. I will be his scapegoat every time because, like, I love my doctor. Dr. Doms is great. I don't think I would be where I am without being able to have somebody like him allow me to make mistakes and take chances. Um, he took chances on kind of everybody that's in our office right now. He hired a dental assistant right outside, just out of school. I mean, I was just having a conversation with him, and he was like, "Man, I knew nothing coming out of coming out of school. I had no idea." And Dr. Dom's like, "All right, hybrid. We're gonna do a hybrid," and it's like he's been there 1 week. And like but he just allows you to kind of have that growth. And so, you know, I've been with doctors who you make mistakes and, it's 8 p.m. and they're still texting you about the mistake you made at 8 a.m.
Oh
And I've
yeah.
been with a doctor who will still tell you about the mistakes that you made, but it's not, it's a learning experience. And so I think that speaks kind of to two of your points. So how I got here, and then my relationship with the doctor is definitely, he's younger, so he's 30, and so because he's 30, I think that just like, we're so close in age that there's not a gap in the way that we think, so we kind of click in that way.
Ashton's a very forward thinking doc.
Yeah.
I mean, so
Yeah,
Andrew
he's a
knows
good
this.
dude. I know him.
You know Ashton.
Yeah.
Okay.
Ashton's very forward thinking. I mean,
Yeah.
Ashton and you are a great marriage.
Yeah. Oh yeah.
You really are, because Ashton is always looking forward. He doesn't look backwards ever.
Yeah. I've never seen somebody take so much bad news and like really turn, like, I don't know if I can curse, but a shit pie and make it
You can curse.
okay.
I say
So
that word all the
like
time. Go
he
for it.
can turn the shit pie and make it like, and he can look at it and like, this is okay, and like, what are we gonna do with this now?
Yep.
And I've never seen somebody who can do that, and somebody so patient. I have never met another guy, just anybody really, but specifically another male in his position that is so patient with everyone. We have an assistant who, she just got to this country in March from Cuba. She was a dentist in Cuba, um, and we still to this day we struggle, communicating. But I mean, his patience is so unmatched. I mean, he will say the same thing to you 8 times until it gets done, but then it's never like that's a problem, or
Right.
you know so it's given me, and definitely I know the rest of the team, there's just so much room to grow. I wish that I could say that like there's something that you could do for everybody, but sometimes I think the best thing you can do in your position is to learn your doctor, learn who they are, and then be the thing that they need you to be, because that's what we're there for. So like once you learn their personality and you kind of know what they're looking for, or how they're going to react in certain situations, you can really mold yourself to be that. And I'm very just lucky and fortunate that I didn't have to do that in this position.
I have a question. So you,
Yeah.
you, you came to dentistry in a very different way. You went through
Mhm.
2 practices. You worked in a call center. Because you do as a manager or as a coordinator, when I work with you and we do training or whatever we're doing, you look at things very freshly and differently. When did you realize that what was the moment, you had the aha moment, that your age and your way of thinking? Because the reality is, and this is going to piss off a lot of office managers when I say it, is 30 years doesn't equal good. And it's a problem. Like people say, like, oh, I've been in this 30 years. You can do things mediocre for
Agreed.
30 years. You can also become good at something in 4 or 5 years. Andrew
Exactly.
built X amount of practices in 4 years, 3 years, whatever it is. Right. Dr. Doms has done awesome. There's probably some doc near Dr. Doms who's been doing it 30 years who can't even get close to Dr. Doms' production. Right. So what was there's an aha moment when you were like, I'm doing this differently and thinking about it differently? What was the moment you realized that it was different, and what was it that caused that?
I would probably say my last office I was at, I had a lot of ideas. And it was a place where they were open to kind of your ideas. I came home one day and I was kind of sitting with my wife, and I was like, I'm not happy. Like, I love my coworkers, and like but I'm just not like feeling fulfilled in my career, and I feel like, and I'm not filling the role, I feel like, the way that I could be. Um, and so I did what any other employee would do. I went on a job hunt. I just kind of I just, not hard. I just, a couple here and there when I saw something pop up, and you put it on Indeed and it sends you something and you put out for it. And I went and I had an interview with somebody, and it happened to be an office management position. It's not the first time I thought I could be an office manager, but it was the first time that somebody was like, "Hey, come in for an interview." And they probably split the difference in age. So the last doc I had was, and he was 65, and this guy isn't as young as Dom's, but kind of in the middle there. And he was opening up his first practice, and we just kind of talked, and he was kind of saying to me that I was saying to him a lot of things that he never thought of. He was kind of asking me how I would run the office, or, what ideas could I bring, to help him. And I was kind of giving those out. And he was like, wow, those are things I never thought of. And when I went home from that interview, I was going to take the position. But when I went home and I was kind of talking with my wife, and I was like, you know, I think I really, you know, I think being who I am, being young and looking at this from, my generation standpoint, and definitely not from like a career dental person, I kind of looked at it more with a sales mindset, gave me that aha, like I know, I have something more to offer than your traditional office manager. I do have family members who work in the dental field. My aunt has been an office manager. She was an office manager for 30 years, and very close with my uncle and my aunt. And, she recently kind of went into like the insurance side of things through like the online insurance verifications. And so like I kind of had an idea of what an office manager did and how they operate. And then I got to see the inner workings of how to run an office and how not to run an office. And my last doc made, I think, a lot of the mistakes of like not being willing to take risks when you're running an office. And like, I can't, like, I understand, but I can't say that I fully understand because I don't own a business. Like, I feel like I own a business. So, like, I approach it, and maybe this is more of my aha moment, is like when I realized that, like, I cared about their business, or at least I felt like I cared about their business just as much as they did, or more than that.
Maybe even more.
Because, like,
Maybe even more.
like
That's
you
true.
work like a business owner, like, and I was a treatment coordinator, and like my wife used to say, you're not getting paid for the amount of effort you put in. I was answering phone calls off the clock. They were having me, they asked me to do that, but but I cared, and not just about the business. Like I care about the patients. Like that is like it's my gift and my curse. Like I care so much about the people who walk in there. Like I want to qualify every person. I want every person to walk out with their new teeth, and like, but I've learned how to separate and not take it personally in terms of like how patients react to me or to the business or like, but maybe to answer the question more direct, it's probably that I feel like my generation or the younger generations, we are more inclined to not work for the man, but to be the man. And like we want to all be our own bosses, and like there's that big kick. And so I feel like part of what we do in our age group is like we think like we're a business owner no matter what. And I think Dr. Dom, I think that's something that like if I could speak for him, he would probably say he likes about me is that I really try to like think about the business just as much as I think about anything else.
I have a question for Dr. Vallo. Andrew, when I navigate your organization, because I'm always navigating your people, right?
Yeah.
I find that you actually employ a lot of people like Anthony in leadership positions. Zach, your operations manager also. Like, honestly, like,
yeah.
Now that I'm thinking about it and Anthony's talking, I've interacted with who's the taller African American guy? He's real skinny. You have he's one of your managers also.
Lee.
Like they all remind me of Anthony, right? So like for you as an owner doc that owns a bunch of practices and you employ a lot of actually, I don't know if any of your managers are 30-year dental people.
No.
Zero are.
No.
Right? So for you, for you on the doc side, you hire a lot of people like Anthony. What is your motivation for hiring younger, less experienced? Like why do you like that mentality more than the typical what every doc? Because every doc kind of like says like, I want to find a really good 20 or 30-year office manager with tons of experience. And my opinion is experience doesn't equal good.
Right.
So what is your motivation?
Yeah, no, I honestly, I've got a lot to say. I've just been kind of listening to Anthony's story here. And I guess, first of all, very cool story about how you ended up in Florida, man. Wife and I moved down from Ohio, not quite as spur of the moment as you guys, but it was one of those similar situations where we always knew we wanted to get out of the cold. And, we had taken some trips down here and we were on one and we were walking the beach, like talking about, should we just do it? Like, should we just move here? What would life be like? All that stuff. And it wasn't too long before the decision was made. And I actually tried to buy a practice down here, and it was like in the 11th hour. We had already sold our house in Ohio. We're moving down to Florida, and like at the last minute, the deal fell through. And so, my wife's like, "What are we going to do?" And I was like, "Well, we're moving. I mean, we already decided we're moving. We'll figure it out. Like, I'll take a job." And that's when I ended up doing my first startup and all that stuff too. But cool story there. I do feel like I've got a affinity for team members that don't necessarily have traditional dental backgrounds, especially for our leadership team. To Matt's point, essentially my entire leadership team, like my main leadership team, there's no dental experience there. My CFO is actually my father. He has 40 years of banking, so he's really helpful with all the numbers and helps make sure that things are making sense and helps us put systems in place, from a financial standpoint. My executive assistant's my brother. He's pharmaceutical management, but had no dental experience. And he actually was temporarily an office manager for us before he became my executive assistant. My operations officer comes from banking and from the airline industry, customer service. So I do feel like there's a lot of other skill sets out there that don't necessarily come from dental. And I think quite often, to Matt's point, the average office manager was a dental assistant, maybe hygienist, front office, and just they were good at their jobs. And over time, they got promoted into an office manager role. And some of them are great office managers. And I do have traditional office managers that had worked their way up through the dental system as well. Although most of mine are definitely on the younger side. But I do think that just because you were a good dental assistant or even a great dental assistant doesn't necessarily mean that you can be a great office manager. I think that there are different skill sets that come along with that. And I have the same philosophy for treatment coordinators. So as important as leaders and managers are within our organization, treatment coordinators to me are just as important. And some of our treatment coordinators make really good money because they're so good at their jobs. So, I mean, basically we compensate our team members based on how much value they bring the organization. So if you can bring extraordinary amount of value, you're going to be compensated, to reflect that. And one of our offices 4 days this week collected over $80,000, and the main reason for that was phenomenal treatment coordinator that's in there. So I mean, she was just closing big cases left and right. And so anyways, a little bit of a ramble here, but I guess that's kind of where my thought process is, Matt, is that, you can have great dental people that can be great managers, great treatment coordinators, but I think there are those certain skill sets that don't necessarily translate to other dental positions. And you can have those skill sets from other experience and sometimes just even from your personality, education, things like that. So I guess my question to you, Anthony, is what do you think from your past helped translate into being a great treatment coordinator, whether it was the sales skills or just the ability to relate to people, to help people, to find a solution, whatever that might be.
Yeah, no. So I like to talk.
Yep.
I've probably already made that very obvious. I'm a talker. I I love to get to know people. I can be very like personable, very just like open and very good at like making small talk feel not like small talk. I don't like small talk, so I really try not to do that. I hate it. Like, how's the weather? Hate that question. Um, but I
Me
like
too.
to find, um, I like to find common interests and kind of talk with people. And so I think I'm really good at building a relationship, like a trustful relationship with patients. Um, and that's really super helpful with treatment coordinating because it's all about your authenticity
Yeah.
and we all like to like every doc puts themselves in an ad and says, "Hey, come here." Um, but the doc is not the person that the patient's going to make or break their decision on. And I have heard for years that you know we have to do the best filling, we have to do the best crown, the best denture. No, you don't. You should, but
Yeah.
but
Yep.
they're not gonna not come back because of your denture work or your crown work. Like repeated times maybe, but they're not. The patients are never basing their decisions based on your work alone. At least maybe only a very select few are. they're making their decisions based on your staff, and that's even before you as the doctor, you know. And that's something that Dr. Doms understands is that, me and Cecilia at the front, uh, we kind of set the tone for every patient that comes in there. So like when a new patient comes, we take them on a little tour of the office. We don't have a terribly large office, but we take them on a tour. They don't get lost. You connect with the patient. They feel like, I mean, how would you feel? You kind of walk into somewhere and someone's like giving you the grand tour, introducing you to everybody. It's probably an introvert's worst nightmare, but it's such a great way to open up a conversation. But from my past, it's definitely like I'm a talker. I've taken in the first ever job I ever had was, I think I told Matt this, was selling newspapers as a telemarketer over the phone. And I was
Oh,
okay.
horrible. Sounds rough.
It was rough. I mean, I was trying to sell, and so like I'm young, so like I was trying to sell newspapers to 90-year-old men over the phone, renewing their subscription for newspapers that most people, unless you're from Jersey, you've probably never even heard of them. And they're super irrelevant. And in a time when like tech was big. But my older brother, he ended up coming to work with me. And he was better than me. And I hated that. I love my brother, but I hate that he seems to be better than me at everything that he does. And he could sell, I used to say it all the time, he could sell a ketchup popsicle to a woman in white gloves.
Is he looking for a job?
I
So to
wish.
move to Florida?
I've been trying to get him to come down here for years now, since I moved here, and he is not budging.
I've got an opening for a treatment coordinator down in your neck of the woods, Tamarack, North Fort Lauderdale.
Like he's so afraid. Like I was like, look, I'll bring you on. Like Dr. Doms will just take you on if I'm like, hey, like let's let him try.
Oh,
because
he can sell. Ashton will say yes.
He can sell. I will never say anybody's better than me, but he could probably sell better than me if he really wanted to. My brother needs to not know his product. He just needs to know you. And so if I took anything from my past, it's that my brother always started his phone conversations with anybody on the news. When he was selling the newspaper, he would start off every conversation with, hey, what do you have going on today?
Love it.
And that was just kind of like his way of learning who they were. And I've definitely applied that, like looking back, and I think subconsciously, like I just like realized that that's something he did, and that I like envied so much that I just tried to pick up that practice because, we're very competitive, and he to this day doesn't let me live it up. And this is like my first job at 16, 17. And so, we're going back over 10 years, and he still to this day does not let me live up that sales. I want to say too that like, sales in dentistry is not a dirty word.
Oh yeah, no, I agree with you 100%.
You need to have a doctor who can understand that as a doctor, you don't have to be in sales because that's not what you're in. You are in patient care. You have the solution to a problem, and I'm there to let the patient know why that solution is the solution for their problem. And so I think it's just about making connections. And I think that that's what I do so well. I make a lot of connections. I would probably say that most patients would say that I'm their friend in the office. And that's been tricky to navigate now, being an office manager. When I was your treatment coordinator, I used to be able to pack it up to when they had a problem,
issues to the OM,
Now I am that person, and so
you got to switch hats for a second, man. If you can sell newspapers, cold calling people, I think you could sell anything. It's like you can dodge a wrench, you can dodge a ball. So in my mind, I think all my treatment coordinators need to go and work for a few weeks trying to sell newspapers on the phone because I think if you try really, really difficult things, it's just going to expand your skill set and it's going to make selling dentistry that much easier. So I love that. And that has been a major mindset shift for me. Again, when I first was starting out, I was like a lot of dentists under the assumption that like I need to hire people with experience. I mean, in all honesty, I was a young dentist. I was opening my first practice or my second practice, and I didn't feel like I knew enough about some of the front office stuff, the insurance stuff, that I felt like it would be the blind leading the blind if I brought in people without significant dental experience. And again, some of them were great employees, and others, just because they had the experience, they didn't have the people skills, they didn't have the sales skills, they didn't have the leadership skills, to be a strong office manager and to really lead a team. So, I mean, I think that's fantastic. And nowadays, when I'm looking for treatment coordinators, I am specifically looking for some kind of sales experience. And honestly, a lot of times I prefer if it's not in dental. I mean, if they have treatment coordinator
100%.
experience, that's great. But if they've got experience, doing something else in sales, in my mind, that's even better sometimes. I think it can even bring up that customer service aspect that much more. So
It's interesting. If a doc comes to me, which happens all the time, and goes, "Hey man, I'm looking at these resumes. I'm going to hire somebody. This one's been a treatment coordinator before a bunch, and this one over here just has sales experience." I would rather roll the dice on the just sales experience.
Mhm.
That's my point of view.
Like, so the top three performers at my last office was me, one of the other girls, and one of the other guys there. And we were consistently the top three in the office in terms of we track treatment by, and it depends on, I guess, how you want to run it. I don't always agree, but we tracked it by a physical collected treatment that we sold. So,
okay,
we had to have collections, and then
yep,
that translated in not just like a yes on the schedule or whatever, but we were the top three, and only one of the three came from dental,
yep,
and he had a military background, which
okay,
I think is really kind of what set him up for what he was doing. I think the military background gave him the mindset that he needed to be in order to do so well. And no dig to any of our treatment coordinators in the pediatric world, but he came from a pediatric office, which is so different in terms of
You're not
what you're
selling
doing.
anything.
Yeah. So like,
Big treatment plan's $800.
yeah, yeah. So like being a treatment coordinator here, um, and the girl, she was a surgical assistant in ORs, like for
interesting. Okay,
neurosurgeons,
yeah,
and just her feet hurt too much, and so she wanted to get out of that. And no sales experience, but just worked with doctors. And so it really matters. Like the sales is the most important thing.
oh yeah,
I don't think any doctor, and you could take my opinion for what it's worth, but I don't think any doctor should ever hire a treatment coordinator without sales experience. Now I say that, and I had only a couple of years of true sales experience, um, but I think you have to know as a treatment coordinator how to continue the conversation when the patient is lost or the customer is
yep,
lost. And I'm still learning how to do that to this day. Matt, I practice what he's told me. I mean, I try to do it so often, and the dopamine rush of when I know I'm doing it and it's working is great, and you try to live off of that because Matt told me, like, you talk too much, and I'm like, that's hard. That's my personality. Like, I am a talker, and
yeah,
Matt is
You
like,
can, you can
shut the
talk
fuck
yourself.
up.
You can talk yourself out of treatment.
I talk myself out of. He said that to me, and that was an holy crap. I couldn't figure out what I was doing wrong this whole time, and like anything that I employed to to sell treatment, I had no idea why all these great ideas from all these speakers and conferences and
yep,
podcasts that you listen to, and literally it came down to just Matt saying, like, you need to shut up because you've been talking yourself out of treatment. And like the more I thought back to all of these conversations, I'm like, no, you're right. Like you gave the idea of the treatment is 6 months long, and the patient was like, I don't want it for 6 months, and then you lost them. And like, so I have employed the shut up method now more than ever, and it has dramatically you know increased my ability to sell treatment to patients, just because I have to know when to be quiet, and I don't like awkward, uncomfortable silences, but now I love them. And I went to a conference a couple weeks ago, and they had a speaker there. His name is Andrew Bustamante, I think. He's a former CIA spy. Really
Okay.
cool guy. He's got a YouTube channel. He's got a podcast, and never heard of him before the conference. But he did a little thing on something called sense making, and like blew my mind because I now use the shut up method with the sense making method, which is just about learning the body language of the other person, and it's like something
Yeah.
they use in the interrogations.
Yeah.
And you can really employ that to know how the patient feels about you, and where they're at. And then I kind of know better when to shut up, and because I know now what their facial expressions or their hand movements mean, where they're at in the decision making process. So
Well, I think it's a fine line, Anthony. I think you have to be a talker in one sense, in that you've got to be able to build a relationship with the patient. So, if you're a true introvert, you hate talking to people, whatever it is, you're probably, I mean, you could do all the training in the world. And I do think there is a certain amount of training that can improve skills. And I think, like anything else, you should continue to try to hone your skills as a treatment coordinator, as a salesperson. But I do think there's a certain portion of it that's innate. I think there are some people that have it and some people that don't. And so I think it's one of those positions where it's again, experience is way less important than, what their personality is like, and do they have that personality where they can be a great salesperson. But I think you're right in the sense that there's a time for talking and there's a time to shut up. And I think that's something that you have to kind of learn as you go through it, is like, hey, in the beginning, you want to talk, you want to build that relationship, you want to find common ground, all that stuff. You want to kind of build a friendship. And then as you're going over treatment, there's a point where you do have to stop, and the next person to talk loses. So you've got to, let the patient talk next at that point. So.
yeah, I agree. Like I had to. That was a hard lesson to learn, and I'm glad that I've been able to learn how to apply that. So
I have another question I want to ask you here real quick. So for any of our docs that are looking for treatment coordinators, and I guess first of all, if you don't have a treatment coordinator, in my mind, this is like just about the most important position in your office. And I've realized that even more so as our group has grown. So I have a larger sample size. I have more offices. One of my offices has 2 full-time treatment coordinators in it. And we record daily their results. So basically they have to record there's a little sheet that they fill out. It's an end of day sheet, and it's super simple. All they've got to do is, on the left side of the sheet, every single patient every single patient they presented to that day that made a deposit for treatment, they're putting on the left side of the sheet. Every single patient that they presented to that did not make a deposit, they're putting on the right side of the sheet. And then at the bottom, there's a percentage. And all they have to do is divide the number of people on the left side by the total number of people on the sheet. And that's their percentage for the day. So I am more focused on, did you get commitment for something from that patient, and did they put money down? That is, to me, the most important thing. And I tell them all the time, not everyone wants to do all their treatment at once. And I'm fine with that. But especially if it's a new patient,
Convert them.
if they leave without putting any money down or scheduling anything, it's a much lower chance that we're going to see them again in the future for their treatment. So like, if we can just get them started and give them that out, let them know if, and I actually am getting out clinically completely. So Tuesday was my last true full clinical day. And I've transitioned to full-time CEO for a group. But when I would have conversations with patients, I would say, hey, I can work at your pace. If you're the type of person where you want less visits to the dentist, you value your time, you just want to come in and have 1 or 2 longer appointments, we can get everything done that way. If you would prefer to attack it in smaller chunks, we can work that way too. And so that way I'm kind of giving them the out that, like, you don't have to do everything at once. If you want to, I can do that. Absolutely, 100%. But you also have the opportunity, if you want to start with just a quadrant, if you want to start with just, I tell them, if you just want to put out the biggest fire, which is this tooth that's about to need a root canal, if we don't do this crown on it, we could start with that tooth. That's no problem. And so I employ that same mindset to my treatment coordinators, is like, hey, let the patient know it's okay. It's not an all or nothing thing. My goal is to get each patient to start their treatment. And so it is very interesting now that we can track daily how our different treatment coordinators are doing between the offices and even within the same office. And it just goes to show you how important that position is and having the right people in the right seat on the bus, because you've got the same office, same doctors, same patient base. And if one person is significantly outperforming the other, just think about the impact that's having on your practice. So
Yeah.
going back to it, at doctors, if you don't have a treatment coordinator in your practice, in my mind, that is, even my startups now, from the very first day, they have treatment coordinator. They have treatment coordinator. Day one. I didn't used to do that, but I've realized how important that position is. So day one,
it's the cash register.
Yes, we stopped hiring just like a receptionist, front desk person, whatever you want to call them. So when we open a startup, it's an office manager and a treatment coordinator. Those are like our two front office team members when we first opened the startup. So super important. If you don't have one, I don't care how big your office is, you should get one. Or if you've got a great team member who you really does have sales experience, you could potentially convert them. What I've been getting to here with this last point is you've got a doc, they're looking for a treatment coordinator. Maybe it's their first one. Maybe they just haven't had luck with them in the past. What are some questions that they should be asking during the interview process? Like what questions do you think, and like what are the answers you'd be looking for if you're looking to hire a great treatment coordinator?
That's a good question. So I think taking it from me and my position where I'm at, right? Like if Dr. Dom's was like, "Hey, we're gonna bring on another treatment coordinator," and he would want me to lead that charge. I think the first, and the most important thing that you can do is you have to meet the person. Too many times where nowadays, especially doctors, are having someone else meet that person and then they're connecting over the phone with that person. But I think it's very important that not just for the treatment coordinator, but for the doctor, that they meet the person. And that meeting really should be in person. The first question that I would probably ask anybody that you're going to bring in the office, because while treatment coordinators are the most important, your whole team needs to be like business and or sales focused. And so I hate to say it, but in a variation of like, sell me this pen.
Yeah.
It sounds so like, you take it from Wolf of Wall Street, but there's a technique to that question. And if there's a treatment coordinator listening to this, it's the whole selling, the end game. And that should be the response to that question. Or even just asking them outright, like if it's not the sell me this pen, but it's like the, how would you approach selling treatment to someone who doesn't have insurance and no credit? I think it's, Matt touches on it a lot in his training, but it's the number one thing we see. I mean, we all know the statistics of the economy where it's at, and so like there's a lot of us in debt. There's a lot of us with low credit scores. There's a lot of us struggling, and I do think it's on the office when they don't when we can't sell a root canal or a crown or a hybrid or a snap-on. It's because we did something wrong in our process. Because anytime someone walks into that furniture store or on the lot to buy a car, and they leave with a car, they know that they did a good job selling the product that they have. And anytime that they don't, those people that are there, they know that there was something that they did that led to the customer not purchasing the product.
Yeah.
It works the same in dentistry. It is the same mentality. Like when somebody leaves and they don't, they didn't get the hybrid. We didn't do our job. And it could be one of us, all of us. It could be the structure in which we're doing things. But I think if you're going to hire a treatment coordinator, you really want to know how they approach failure, how they approach success, and do they take things personally? And I think you need to a little bit. Like I'm very unorthodox, as Matt would say. Like I think a little bit differently. Like you need to take it personally sometimes. You
Okay.
have to feel a little bit like this person didn't get treatment. That's on me.
Yeah.
Um, because like in my office, I'm the office manager and then I have a treatment coordinator, and that's how we run the office right now. So I don't really have a healthy competition. So my healthy competition is inside. Like I have to compete with myself to do better. And I feel like not everybody has that ability to compete with themselves. Some people may take it so personally that they shut down.
Yep.
You know, I do Matt's little like hype up things before I go in the room. Just try to let go of anything personal or anything, whatever. Um, and then I think another large question to ask somebody um, is, would they consider themselves like um, as a chameleon or somebody that can be personality kind of, all over?
Can they match the energy of the patient? That type of a thing.
Yeah,
Yep.
like every time. Um, if you're a Trump supporter, I'm a Trump supporter. If you're a Harris supporter, I'm a Harris supporter. If
Yep.
like not that I say those things, but that like I say that to say that like no matter where you come from, I'm gonna connect with you. Um, and I'll be honest, I think that as a doctor, you can learn a lot more about a treatment coordinator just having a normal conversation with them
Okay.
than you will ever learn from any individual question. I think just talking with them would give you everything you need to know about who they are. Because if the vibe isn't right to you, the vibe is never going to be right to the patient. And they
Right.
may be able to answer questions well. Maybe they listen to this podcast. Maybe they listen to another one. And like, there's a lot of like how to answer questions or, what to ask or what to say or, there's ChatGPT. And like, I think like the authentic interaction, like I don't, I like to say I'm very humble. Like I try to be very humble. So like I know that like I'm not perfect and I would not even say that I'm one of the greatest treatment coordinators or office managers to ever exist, because the truth is like I make myself what I make myself because my team allows me to make myself that way. My doctor allows me to grow. So if you're a treatment coordinator and a doctor is looking to hire you, or if you're, let's say you've never been a treatment coordinator and you get an interview to be a treatment coordinator. Like when I came here to Florida, I had never been a treatment coordinator. I had dental, but I had never coordinated treatment. I basically worked in a call center, like appointment scheduling thing. So we took in the call and then we put them on the schedule, and that was it. Um, I think from the doctor's standpoint, you are looking at a treatment coordinator, you're looking for a doctor that matches your personality,
Okay.
but not, it's kind of like, it's kind of like being in a relationship. Like my wife is the complete opposite of me in everything. And
Yep.
it just so happens that Dr. Doms is probably also opposite of me in everything, except that we are both like business strategy thinking people. So first ever time I heard of the term like entrepreneur. So you have an
Okay.
entrepreneur
Yep.
who
Yep.
goes out.
Yep.
It's the first time I
Yep.
ever heard of entrepreneurs from him.
Yep.
Um, and that like he saw that in me. I didn't even know that I had that quality, but I think, but like we couldn't be more obvious. Like my wife and him are the same sign. If people care about signs, I'm a Cancer. They're both Leos. We're not supposed to mix, but
Okay.
somehow we do. And it's just like you both have to have the same kind of like, I guess, end goal. Um, and as a treatment coordinator, you have got to want it just as much as the doctor does. Like I recognize that my success in my career is based on how well the business does,
Right.
and it's the same thing for the doctor. And
Yeah.
so I think it's probably hard for you guys, even as doctors. And I know like the biggest joke in dentistry is always like the doctors are awkward, or like, I mean, you meet a lot of doctors who are good at they're good in the books, but they're not good with patients. Dr. Doms is one of those doctors who happens to be good at both. He's a nerd
Right.
and
Yep.
he likes people and people like him. Um, and that doesn't always happen, but I think you're really looking for personality over anything. And it's hard when it gets there because there's not really specific questions that you can ask to gauge their personality. Um, because, like you said, I think they need that on top of sales experience. but I think they need the personality, because you can't teach somebody how to be more open or more engaging, or, I have to pull, like, I've learned the patient doesn't want to be there, you know,
Right. Right.
and this is new for them. It's not new for me. I work there, but this is new for them. This might be the
Yes.
first time coming to the office. And because it's so new and because they've never been there, they're going to be guarded, just like we are with anything new. And like, it's on
100%.
me
Yep.
to pull them out to make them feel comfortable. And advice to a doctor is what you and Matt have been saying. Like, like 30 years, it might just be 30 years mediocre. I don't know the person that was before me. I hear stories of the way that she ran things. I know that, she had been in the dental field much longer than I have. They weren't happy with the way that things are.
Yeah.
You have to be careful with people who have been in dental or any medical field, or really any field, but specifically dental. If you came to me, if I had a treatment coordinator and their resume said they have 20 years experience, and I have one whose resume said that they had no years experience, I look at them as complete equals. And the reason why is because that 20 years of experience, they have 20 years of experience working for Dr. Smith. And I don't know how Dr. Smith ran his practice. And
Right. Yep.
too often you get treatment coordinators or anybody who's just worked with a doc for so long that they don't, and after so many years, they don't know how to retrain themselves to be what you're looking for. And I think that that's what made me successful with Dr. Doms thus far. Why he was so attracted to hiring me was that I came from an office and I wasn't the happiest there, but I worked my ass off to try to make that office as successful. I was going to touch on this in the story before, but when I applied and I got that interview to be an office manager, and I was going to take that position, I went to my office manager at the time and I said, hey, I've decided to leave. I was so nervous for the whole weekend because I'm like, I don't want to tell them this, but like,
Right. Yep.
I got to give them my truth. My She was my fiance at the time, but my wife was like, babe, they're gonna tell you, they're gonna try to keep you. And I was like, absolutely not. I have never worked in a place where anyone has ever valued me more than I'm just an employee. And they had shown that to me with other employees there. So I was like, there's no way. Like, they're not gonna. There's nothing for them to offer me. Like, what are they gonna offer me? Well, he was opening another practice in Lake Worth, and I told the office manager that I was gonna go. Um, and I went through my whole thing because like I could just talk, and so went through my whole prepared thing in my head. And at the very end, she said, "Well, you at least have to let us counter offer." I was blown away,
Yeah.
and like they counter offered me, and I moved to that other office, and still wasn't what I was looking for. They couldn't offer me office manager, but they could offer me front desk manager, and like so I did front desk managing for very small amount of time there before I moved away. But I say that to say that my biggest work experience is just that last office, like in dental.
Okay.
And I was there for 2.5 years. And that's probably like the most time I've spent in one office, kind of learning the way that I definitely was a treatment coordinator and they molded me into that treatment coordinator that I was.
Yeah.
And there are things that I've had to take away from that. But I was willing to not be that treatment coordinator. I was willing to learn the things that could make me better. And that's so important. Like, I have a lot of respect that Dr. Doms, sent us to conferences. You know, he
Yep.
like I was like, hey, like there's a conference here and it's cool and I'd like to do it. And he was like, book it, like, go do it. Um, and I learned so much from that conference. And like I learned just so much about how to sell treatment. I learned so much just about me as a person and what I'm doing right and wrong, that like I don't know how I ever could have learned those things without somebody saying, I know you're doing this, and if you're doing this, it's wrong. And I'm like, how did you know that I'm doing that? Like,
Yeah.
but
Yep.
you have to invest in your team. If you're a doctor, and any advice I can give to a doctor, you definitely need a treatment coordinator, and you need someone to follow up on leads.
Yes.
A
Follow up is so
dedicated
important.
person
Yep.
to follow up on leads, and that's all they do is follow up on your leads. Like if you're working with Energize or any company and they are lead focused, and you have leads out there, like we try to get back to our leads in 5 minutes or less.
Yeah.
Every lead that comes through, and like for a couple of months there, like it was just me and the doc, and it's overwhelmingly difficult. And like now we have somebody who that's what they do. They just follow up on leads all day.
Yep.
So you need that. I think you definitely need a treatment coordinator. I didn't even know that there were offices out there that may not have treatment coordinators.
Oh
I just
yeah.
kind of thought that was baked into the system.
No, there's a lot that don't. Yep.
If you don't have a treatment coordinator, you are missing out on $500,000 in revenue without them, because your treatment coordinators are the only people in the office who are focused on bringing your patients to the finish line.
Yeah, I think there's a lot of offices that just have all of their different team members present treatment. And, again, when we first started out, we kind of did that. And you realize, again, one, there's a lot of people that just don't have the personality to do it. But two, if you've got 6 or 7 different people presenting treatment, like nobody's really following up with it. So, and everyone has so many other things on their plate that it's almost an afterthought, and they're thinking about that next patient that they got to get seated in the room, they got to flip, versus the treatment coordinator who's only thinking about helping that patient move forward with their treatment. So
exactly.
I love what you said about the chameleon. I think that is so important and such a good lesson is that, if you may present to 10 patients in a day and they may have 10 completely different personalities, and all 10 of them have to feel like they can relate to you and like you. And so I think that is a very important skill for any salesperson, any treatment coordinator, is having that ability to, find common ground and to match the energy of the patient and to make it feel like you're an old friend, no matter what their personality is like. So I think that's huge. I mean, I agree with you. I think anyone can excel in an interview. Anyone can, excel on paper, but I think that I think role playing is really important. We do a lot of it now. So, I think one of the role plays we like to do is where, we got the treatment coordinator that's interviewing, and the other person is basically being a patient who has a whole bunch of concerns. And it's like every single rebuttal, oh, I can't afford it. Oh, I've got to talk to my spouse. Oh, I don't know if I can get off work, and so it's like, how well do they just on the fly answer these rebuttals? And I love people whose energy is like, oh, no problem. Oh, no problem. We're going to figure this out. No problem. Hey, I've got another solution. No matter what the concern is that the patient brings up, I've got a solution that we're going to help. We're going to solve this together. We're on the same team. I'm the patient advocate. My job is to help find a way to make this treatment that you want and need fit in your life and in your budget. And I'm really good at my job. We're going to find a way to get this done. So I think that's huge, is doing some of that role playing there for sure. I like the analogy, of sell me the pen. And actually, for the first time ever, we did a treatment coordinator working interview. So I've never really done that before, but we tried it at one of my offices where we're looking for a new treatment coordinator. And she came in and she worked 2 or 3 days this week and just absolutely killed. We had her do the end of day sheets just like our treatment coordinators do. And I mean, her treatment acceptance, each day, I think her lowest day was like 70%. And one day she had like 90%. So just like absolutely phenomenal numbers. Wow. And I didn't even interview her. Normally key positions, hygienists, treatment coordinators, office managers, I'm doing a final interview before we offer them the job. But I literally saw her end of day sheets and I saw the production and collection from the office that week. And I was like, she's hired. I don't even need to talk to her. I don't have any questions I need to ask her. I just need to know how much she wants and if it fits in our budget, if we can make it work. And I think we're going to make it work because, I mean, she did a phenomenal job. So
no, I like that. I love that point. That's a big deal. You have to do a working interview. It's the next step after that initial interview, if you have one, is doing a working interview, because there's a lot that I can say, but it's the only way that I can back that up is by doing the working interview. And it also lets you know how good I am in a new, uncomfortable environment, because every time a patient walks into that operatory, that's a new and uncomfortable environment for me. And so it kind of just lets you know how I'm going to operate. But
that's such a great point, man. I think some docs, would be afraid to do a working interview with the treat because they're like, I don't want someone who's not trained on our systems presenting treatment. And what if, what if they suck? What if they don't, they get no's? But here's the thing, at the end of the day, would you rather have one day where you lose out on some treatment because this person just isn't the right fit? Or would you rather hire them without doing that and then spend the next 90 days trying to train them and realize you just had 90 days of poor treatment acceptance because this wasn't the right person? So I think that's a good point. I think your point about, how timid are they coming into a scary new environment with little training? Again, for this position, you've got to have that confidence. You've got to have that competitive edge where you're willing and able to push your comfort zone and basically be thrown into this position where you don't have experience on the systems and maybe the, open dental or whatever they're using, or flex if they're presenting with that. So like, how well do you adapt on the fly, and how comfortable are you just kind of doing that? And I think that says a lot about their personality and their ability to be a great treatment coordinator. So, Anthony, I really, really appreciate you being on here today, guys. This was one of our longer episodes in a while, but that just goes to show you how important I think treatment coordinators, management leaders, are within your practice, how important it is to find the right ones, how important it is to empower them. As dentists, we often have an issue of micromanaging, giving very short leashes. And I think something Anthony touched on earlier is like, while sometimes we may think we're the smartest person in the room, there's a lot of other people out there in your team that can have great ideas. And your practice is not going to grow if you don't empower your team members to come forward with their ideas. So I think that's huge too. Thank you again, man. It was great to meet you. It was great chatting with you. I hope the listeners got a lot out of our conversation today. I'm sure that they did. Quick recap for you guys. If you don't have a treatment coordinator, you need to hire one. Finding great treatment coordinators, more important to find personality, sales experience than dental experience that can be taught. Working interviews and role playing can be really helpful when you're trying to do that. And sometimes somebody having 20 or 30 years of dental experience isn't necessarily a good thing. It doesn't mean it's a bad thing. It just means it's not guaranteed to be a good thing because to Anthony's point, they could have worked 20 years of dental office who had no idea how to run a business. There's a lot of dentists out there that unfortunately don't know how to run a business, and they may have been taught some terrible systems and policies over the years. So guys, thank you for listening. As always, this is Dental Unfiltered. Matt and I do this out of the goodness of our hearts. We have no sponsors. We make no money from this, but we really do enjoy chatting with each other and chatting with some awesome guests about everything we've learned, mainly in the dental business, industry. But if you enjoy it, if you got some value out of this, we appreciate if you share the episode with fellow dentists that you think may enjoy it. We appreciate if you leave us a review. We do take the time to read all the reviews that come in. And as always, if you have a specific question about today's episode or another episode, feel free to reach out to me. Best way to get in touch is my email. It's docvallodds@gmail.com. Hope everyone has a great day. Take care, guys.